Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. On today's episode, I'm going to be talking about treating post-COVID patients. Now, this episode might be triggering for a few people, but I really think it's important to get the information out there. This past year has been a struggle for everyone. The world has been turned upside down. What seemed like the best thing to do, hugging loved ones, turned out to be the worst thing you could do. It's been a lot for me to kind of get to this place where I feel like I should talk about it. It wasn't really until my dear friend gave me Melinda Gates' book, The Moment of Lift. In it, Melinda talks about the feeling of pressure to take on big tasks like decreasing the infant mortality rate. But after seeing some of these families and hearing the stories of other healthcare workers, she knew that she had no other choice but to try. So here is my effort to try to share as much information as I can. And I think it's important with the novelty of COVID that this information gets to the general public, as well as try to get to the medical professionals. So to date, about 119 million cases have been confirmed globally of COVID. But I think we can all agree that it's a lot higher than that. I'm happy to see that the cases are starting to go down and the vaccines are out there. And hopefully we will be on the other side of this sooner rather than later. I can't imagine the horrific scenes that frontline healthcare workers have seen during this pandemic. A lot of them have been my patients, and it's hard to believe that their stories are real life and not just a movie. As the emergency and urgency of the pandemic starts to die down, then comes picking up the pieces. This is where other healthcare providers are going to become really important. One of the most striking things that I've seen time and time again with my patients that have had COVID is that a lot of them aren't what these quote unquote long haulers are, but are dealing with other musculoskeletal issues that they don't think are related to their COVID diagnosis. But what I'm finding is there seems to be a common thread. So it's really important to get this information out because I feel like, and I fear that there are going to be a lot of people that are dealing with these issues that they just can't seem to get an answer to, when really it's because of their COVID diagnosis and the disease process that has occurred in their body that has left them to the sequelae of where they are now. And this is why I just couldn't sit back anymore and not talk about this, because I think it's really important and I see the impact that it's having on my patients, and they're surprised to see that the pains and aches that they're having in their body might all be related to when they had COVID and what occurred. So in today's episode, I'm going to be talking about the research around the cardiac involvement with COVID, the pericardial ligaments, and the effects if there are restrictions of those pericardial ligaments. And I'm going to give quite a few patient examples. This is very new information. It's a new disease. And so there's not a lot of studies that are looking at these less severe cases and what else is happening through the body. So really, all I can give you is my anecdotal information. But after seeing dozens of post-COVID patients, I feel confident in sharing this information and bringing together the information and what I'm seeing as the common thread with all of these patients. And finally, I'll talk about how to treat COVID during the disease process and also afterwards as well. So let's dive into the research first. COVID is mostly known as a respiratory disease, but what I want to focus on today is actually the cardiac involvement. Now, you'll see as I go through today's episode why I chose to focus on the pericardium and the pericardial ligaments. Just kind of a quick overview before we talk about the research. The pericardium is like the cushion for the heart within the rib cage. It's surrounding the heart, and it has these ligaments that are holding up the heart to kind of keep it suspended within the rib cage. Initially, the belief was that only the severe cases had the heart and pericardial involvement. But we're finding that that's not really true. The effects of the heart are being seen in less severe cases and even in patients that are asymptomatic. One study in New York was looking at patients that were coming into the hospital, and about 67% of them showed pericardial ligament involvement. Now, those are patients that went to the hospital, so they were more severe cases. In a study in Germany, they looked at patients after they had recovered from COVID, and they found 60% of them had ongoing heart inflammation. And a lot of them had never required hospitalization. They're also finding inflammation in the heart and around the heart in elite athletes. In one study, Division I athletes in the Midwest, they found about 11% of them had showed inflammation around the heart post-COVID. In a study that hasn't yet been published, they show a high accuracy rate of diagnosing COVID from just doing a cardiac ultrasound, regardless of what the symptoms were. So they didn't need to do the nasal swab. They didn't need to do a spit test. They could actually just take an ultrasound of the heart and see changes of the pericardial ligaments. Yet again, regardless if anybody had symptoms or what the symptoms were. So I think we can see here that this isn't just a respiratory disease. There's a big effect on the heart, which the heart is sitting between the lungs, so it's not so crazy to see that there would be involvement of the heart. But why is this so important? Why am I focusing on these pericardial ligaments? Well, I think it all comes back to the hierarchy of the organ systems, which is a lot of what I base how I treat and how I look at the body, because I believe that the body will protect the most important organ systems first and foremost. And the top two organ systems in the body are your nervous system and your cardiovascular system. So if there's involvement of the heart and the cushion around this heart, the pericardium and the suspensory ligaments that are keeping the heart within the rib cage, then I don't think it's crazy to say that this could be leading to a lot of these issues post-COVID, either in your long haulers or these other people that I've been having come into my office that are having other musculoskeletal dysfunctions. Now, there's multiple ligaments that hold up the heart. There's two in the front, then at the bottom of the heart, one at the top of the heart, which attach the heart to the back of the sternum or the breastbone. You also have ones that go from the back of the heart up to the cervical spine, so up to your neck. The last major pericardial ligament is actually attaching the diaphragm to the heart, and it's a donut shape in which the heart sits on. There are also the multiple blood vessels that are going to and from the heart that kind of lead to its structure and encasing it within the thoracic cavity or the rib cage. So if any of these are affected, it can lead to issues all throughout the body. As you can see, it attaches all the way up to the neck. It goes down to the diaphragm. And so what I'm seeing with my patients is that really the effects that they're feeling in their body or the pain they're feeling in the body could be anywhere. But the problem most often is these pericardial ligaments. Because remember, the body's trying to protect itself first and foremost. So if there's issues with the heart, if the pericardial ligament, that's a suspensory system to keep the heart safe, is affected, then your body is going to go into survival mode and it will make changes to try to ensure your safety. So let's talk about some patient examples. Now, there's a lot of talk right now, and I'm happy that it's finally coming out about long haulers, or what they have now officially called PASC, post-acute sequelae of SARS-CoV-2 infection. This is something that I've been seeing since the beginning of the pandemic and had lectured at in different continuing education courses that I was teaching. Because as obvious as it is, the focus should be on the acute issue in keeping people alive. I knew this and I saw this coming of the people that are going to be dealing with issues and dysfunctions after they've recovered from COVID. Because that's what I saw with my patients that had COVID right at the beginning of the pandemic before lockdown even occurred. And I was seeing them after they had recovered with all these different symptoms, all these kind of crazy symptoms going on through their bodies. The long haulers or the PASC patients are dealing with symptoms like fatigue and shortness of breath, brain fog, sleeping disorders, gastrointestinal issues, anxiety, depression, and dizziness. Now, by looking at the anatomy of the heart and what's involved with these pericardial ligaments, I think this could be the big cause of these symptoms that they're feeling. There's something called the vagus nerve. It exits from the skull and goes down into the heart, and then after the heart, travels down into your abdomen via your esophagus, and then enters into your abdominal cavity and goes all throughout. Now, the vagus nerve is important because it's a big component of your rest and digest system. So a lot of people have heard about the fight or flight response. This is the opposite. You're either in fight or flight or rest and digest. The vagus nerve's number one job is to actually regulate your heart rate, to keep it down, not allow it to get too high. If the vagus nerve is affected and kind of as it's going through the pericardium And if there's any sort of restrictions into the pericardial ligaments that are going up into the neck, it could have an effect on the vagus nerve. So a lot of treatments of vagus nerve can help with anxiety and depression, and also this idea of brain fog and sleep disorders, especially sleep disorders where the people are waking up and almost like they have an adrenaline rush. It could be that the vagus nerve isn't working very right. This also can explain the dizziness that a lot of patients are complaining about. I've heard many patients of my own, and then also just hearing other people in the media sharing their experiences, that this dizziness almost makes them want to pass out. When you're wanting to pass out, it's because your blood pressure has gotten so low that no longer can the heart beat enough to push the blood up to your head. So your body's instinct is to make you pass out so that you're no longer vertical, having to fight gravity, but you go horizontal and blood can flow to your brain easier. I see with a lot of these patients, it's the vagus nerve that's being affected, that this is what's kind of leading to their dizziness and their headaches, and also their sleep disorders at night. Now, the sleep disorders are really when you're trying to sleep and you wake up with a fight or flight response. I equate this to the vagus nerve being affected. Also, other than just the vagus nerve, it could be the diaphragm that's the issue. So everyone knows that when you are freaking out and kind of hyperventilating, they want you to breathe into a paper bag, right? That's the old way of dealing with a kind of panic attack, and it will slow down your breathing. So the diaphragm is the main source of getting a good lung expansion of air. So if the diaphragm is being restricted and kind of held against the heart, it's not going to be able to drop down properly. And this is going to lead to a lot of anxiety and shortness of breath, as well as fatigue. An area that you might not think would be associated with the diaphragm being an issue is these GI problems that these patients are complaining about that have this long hauler syndrome. With the GI system, you need to have things moving. You need to have mobility through your digestive tract, and the diaphragm is a huge component of that. In the most efficient state, the kidneys in the back will actually move down and up almost an inch if they have a good diaphragmatic breath. It's important for the diaphragm to be moving down into the abdomen, creating pressure, and then releasing pressure as you exhale. It keeps everything moving, everything going. A lot of people that I treat with digestive issues, one of the first places I'm going is to the diaphragm, because you need to have that constant mobility occurring with a good diaphragmatic breath. So if you take away the ability for the diaphragm to work because of restrictions of that pericardial ligament, that donut that the heart is sitting on, connecting it to the diaphragm, then you'll find that there's going to be less mobility of your GI tract. And this will also lead to anxiety, not able to catch your breath right, not able to take a deep breath, and shortness of breath. So when I'm looking at the list of what these long haulers are complaining about and what is categorized as PASC, I can make a lot of connections using critical thinking back to the heart and these pericardial ligament restrictions. So I think that this is an area that really needs to be addressed with these people that are dealing with long hauler. And my patients that I have treated with this have done really well with just trying to mobilize the pericardial ligaments and working on getting them to expand their rib cage and breathe in all different directions. So if you're dealing with long hauler syndrome or any of these issues post-COVID, you really want to think about getting that heart to move around more and get better mobility of those pericardial ligaments. Now let's talk about some patients that I've had that aren't technically long haulers, but a lot of their musculoskeletal dysfunction went back to restrictions of the pericardium. I want to preface this with all of these patients that I will discuss in today's episode were all of my patients prior to having their COVID diagnosis as well, and I knew their bodies really well. These weren't people that I had just met once and had one treatment. These are people that I have known for a while and understand how their bodies work and the dysfunctions they were already dealing with prior to their COVID diagnosis. None of these patients were hospitalized, and most only had mild symptoms, and a few of them were actually asymptomatic. The first patient I'm going to discuss came to see me for a week. She was from out of town, so we did an intensive 4-day treatment session. She is a professional athlete and had tingling and weakness down her right arm. Now, when I had first met her many years ago, her initial complaints to me were similar symptoms, but on her left side. So thinking that it was similar to what she had before, I just went along and was treating how I normally would, looking at how the shoulder girdle moves, looking at the neck, and looking at freeing up the nerves. But this was having no effect whatsoever on her symptoms. It wasn't until we really got into talking more about what she dealt with COVID, which her symptoms were mainly just GI issues with a little bit of shortness of breath. She did state, though, about 6 weeks after recovering from COVID, she was trying to build up her stamina again and would have heart palpitations whenever she was going on hikes. She had since gotten past that, but was still kind of having some issues with fatigue. So it wasn't until I treated the pericardial ligaments, and specifically the ones that go from the back of the heart up into the neck, that we had the greatest effect on her symptoms. I did this on the 3rd and 4th day, and she said by a week later, she had no issues anymore with her arm, and that keeping up with her home exercise program really helped keep everything at bay and is no longer having issues with her sport. Now, another patient I had coming in had pelvic floor pain. I had treated her for pelvic floor issues in the past as well, but she said this time this was a little different. She had had trauma before that had caused the pelvic floor pain, but had reported no trauma whatsoever when this pelvic floor pain started. I went the same way that I did before, treating what I had with the tailbone and looking at the mobility of her pelvis, trying to assess all the alignments, and wasn't having great effect. It wasn't until she mentioned that she had had COVID in the summer that I decided to look at the pericardial ligaments. And for her, it was the ligament that attaches the diaphragm to the heart that was the biggest restriction. And if you listen to my episode on the core, I think it was episode 2, I talk about the importance of the diaphragm in terms of getting your pelvic floor to fire and how it's all connected. And so she wasn't able to get that connection of the core and that tightening of the core. And with her profession, she really needed to have that core tightening because she had a very physical job, but she wasn't able to achieve it. And it led to this dysfunction and pain through her pelvic floor. She was extremely tender when I was treating in through the diaphragm and trying to get mobility of that pericardial ligament. But she did note that right after that, she had the most relief of her pelvic floor pain. Her home exercise program then really focused on improving the mobility of her diaphragm and keep her diaphragm working, trying to retrain her body now to keep that diaphragm moving when she's breathing, when she's walking, and everything that she's doing so that the irritation of her pelvic floor wouldn't come back. Another patient had low back pain about 2 months after having COVID. Now, low back pain is not something new for her. She has suffered it with him from the past, but she's always been able to kind of get herself out of that pain. She has different techniques and different exercises that help her so that she no longer has that pain, but she was finding that all of her tips and tricks weren't working. When she came into my office, the first thing I looked at was her pelvic alignment, because that's kind of her MO, is when her low back is flaring up, it's because her pelvis is off. But when I looked at it, there wasn't a big difference there. So I went more to just kind of looking at her range of motion and feeling through her system as she was doing these motions. It became most evident with looking at side bending and rotation that there was almost no motion happening from the thoracic spine, which was not like her in the past at all. The issues had usually been from the pelvis, not from higher up. So why did this cause low back pain in her if her rib cage wasn't moving? Well, in the efficient state, you should have evenly dispersed motion happening across all the segments. So even with turning your head to the right, really you should see motion happening all the way down your spine, not just in your neck. That is efficiency. Inefficiency is when you have these areas of hypomobility or not enough motion, and then you kind of skipping over those. So when she had these kind of block of her thoracic spine, her rib cage not moving because of these pericardial ligament restrictions, it made it so that instead of having that motion evenly dispersed throughout her spine, the majority of it was having to go to her lumbar spine. So this area of hypomobility, not enough motion, created a hypermobility in her low back. there was too much motion occurring through her lumbar spine, and that actually led to a disc irritation. Discs don't like to have too much rotation on them. They're not great alignment for rotation stresses. And so now her spine that wasn't used to having to rotate so much and have so much emotion occurring in those lower lumbar segments, were taking all of that motion. And that's where the breakdown occurred. And that's what was causing her low back pain. So for me to effectively treat her low back pain, I needed to first go to her chest and work on those pericardial ligaments. So now for her, it was actually those ligaments that were on the front of the heart that are going to the back of the chest bone or the back of the sternum. Those were what were restricted. And I could tell that when she was breathing too, that she didn't have good mobility there through the front of her sternum. Treating those front pericardial ligaments first, then allowed it for the rib cage to unlock and that motion to be more evenly distributed through the entire spine. And then I could go focus on what was happening in the lumbar spine and trying to clear up that disc irritation that she had. That was the site of pain, but that wasn't the cause of pain. I see this time and time again with just patients, not COVID, but any other patients, that when you have an area of hypomobility, not enough motion, it causes areas of hypermobility, which is usually where the site of pain is. But to have a lasting effect, you need to go after that area of not enough motion. The final patient I want to discuss was actually completely asymptomatic. She had no symptoms whatsoever. People she knew and lived with her had the virus, but it wasn't until she got tested to go back to work that she found out that, yes, she actually had COVID. Starting about 6 weeks after the end of her kind of quarantine isolation period, she started to have a lot of pain in through her low back, and she knew that her pelvis was off. When I had initially treated her, that was the main cause of pain prior to COVID, was that her pelvis was off. There was an elevation of one side of her pelvis, but we had since dealt with that, and it hadn't come back for about 2 years. So all of a sudden she knew that her pelvis was elevated on one side. And again, when she came in, I was looking at her alignment. She had told me that she had asymptomatic COVID. And when I was rotating her, side bending her, it all came back to the pericardial ligaments again. So this kind of fun experiment for me was, okay, I'm not going to touch your pelvis at all. I'm going to go straight for the pericardium, and let's see if we can affect change on what's happening with your pelvis. I'm not kidding you. It was 15 minutes of treatment on the pericardial ligaments. For her, it was the ligament that's on the front, but at the bottom of the heart, attaching to the sternum, and a little bit of the diaphragmatic pericardial ligament that were the biggest restrictions. And as soon as we cleared those up, 15 minutes, stood her back up again, her pelvis was back to equal height and her range of motion was fully back. Now, I spent the rest of the time kind of treating a little bit more of the pericardial ligaments and then relaxing some of the muscles that had been affected with this elevation of the pelvis. But it was a great example of someone that had no symptoms whatsoever, that would have never known she had COVID if she hadn't been tested for it. And she had this dysfunction in her body that I could have spent all the time trying to get that pelvis to go back down again, but it would have popped right back up and the recidivism would have continued. I have a saying that injuries are like a leak through your ceiling. The ceiling tile where water's coming down is usually the site of pain, but water didn't just magically appear there. It came from somewhere else. So my job is to find the leak, stop the leak, then replace the ceiling tiles. Recidivism of that issue keep coming back is that I haven't found the leak. I'm just replacing ceiling tiles, which is just a waste of time and money and also pain for the patient that they don't need to be going through. So I was able to assess her system and feel for this dysfunction through her pericardial ligaments. And because I have seen many dozen post-COVID patients now and are seeing this pattern over and over again, I was able to help her and get her feeling better rather than trying to dig in and figure out why her pelvis keeps going out of place and why she's still staying in pain. If you've had COVID and are experiencing these other kind of musculoskeletal dysfunctions, or maybe they're the same dysfunctions that you've had before, but they're not getting better by the treatments that you used to do, it could be that the pericardium and those pericardial ligaments are to blame for the issue. Now, how do we treat it? The biggest thing is about trying to improve the mobility of the rib cage and keep it there. When I've had patients that have emailed me and said, I have COVID now, I got a positive COVID diagnosis, the first thing I tell them is you need to keep moving, and you need to keep moving your chest and your rib cage. I suggest that they do exercises as kind of cat-cow, so where they're on all fours and arching and sagging their back, and also doing an exercise called Around the World based on Feldenkrais's movements patterns, where they're lying on their side and they're trying to draw a big circle with their arm and breathing as they move around. Because I think it's important, as this inflammatory process is occurring through their body because of COVID, that we try to keep the extensibility of these tissues. So as the inflammatory process goes down and starts to recede, that you don't get these hardening of the ligaments, but we're always trying to stretch the ligaments out. Now, that doesn't mean that I think you need to go out and do some crazy yoga or anything like that when you're dealing with your COVID symptoms and dealing with the disease process. But I think it's important to keep your body moving and to work your breathing, and as much as you can, get mobility through your thoracic spine. Now, after they have recovered from COVID and they're coming back into the office, one of the first things to assess is how is their rib cage moving. Now, you can do this by looking at mobility as they kind of bend forward, go back into extension, side bend from right to left, rotate, any of those kind of physiological motions that their body should naturally be able to do, and kind of feel for where it feels stiff. And patients should be able to feel it too. You should be able to feel where you feel stuck. If the issue is when you side bend to the right, is it that you're kind of bunching in on the right and you feel like that's what's blocking you? Or is that you can't lengthen through your left-hand side? Or when you're rotating, where do you feel tension with that rotation? Where do you feel like you're limited in? The last thing to assess is how they're breathing and how the expansion of their rib cage is going. So to understand the two mechanisms that we would be assessing with breathing, it's the bucket handle and the pump handle approach. So the bucket handle is this coming out from the sides of your ribs. So it should be that bucket handle is able to kind of swing open and then go back down again. So you want to think about going out, expanding out and up, and then returning back down again. So that's the bucket handle. So you want to see how that bucket handle is, how that lateral outside of the rib cage can move. The pump handle is the old-timey water pump where you're at the well and you see in the Western movies how they're having to pump up and down to then get the water flowing from the well. So that's how the sternum's moving. So it should be when you breathe in, the sternum should be kind of coming up and forward, almost like it's hinging from up by your collarbone and then relaxing back down again. So you want to look at that hinge mobility through there. And then also you want to look at the diaphragm motion, or the ability to breathe through their belly. The home exercise program that I give those patients post-COVID is usually to really try to improve the mobility of their rib cage when they're breathing. My job in the clinic is to try to put those pericardial ligaments on tension and try to get mobility there, but I want them to then also reinstate it when they're home. I think it's important to then, depending on the analysis and assessment that you have made as to what is limited in their rib cage mobility, based on that, give them a home exercise program that makes sense to try to reinstate this rib cage mobility. Some of those exercises might include going into prayer position or child's pose and doing some deep breathing in through there, just trying to get the expansion through the back side of their ribs. This will help with a little bit of that pericardial vertebral ligament that's going up from the back of the heart up onto your neck. If you really want to try to block the diaphragm, then have them put a pillow between their thighs and their stomach. And this will kind of put pressure that will make it so that their diaphragm can't activate as much, and the expansion will be coming through the back of their body. When helping to reinstate the bucket handle motion of breathing, lie on your side. So we'll say lying on the right side on a pillow or on towels, just to kind of block that right side of your ribs. And then while you're taking a deep breath in, reach your arm overhead, really trying to expand the left side of the ribs as much as possible. This will help reinstate that bucket handle motion. It's good to do it on both sides. To get back the pump handle motion, I think that around the world exercise where you're on your side and trying to make big circles with your arm, but really working that inhalation, and especially as you kind of go back and rolling onto your back, is good at getting that sternum to move up and forward. So really kind of stretching the whole system as you move around and making a forceful breath inwards will help to free up that front of the sternum and free it up from the heart. Can't forget about the diaphragm though. Now, this is an exercise that I was taught many years ago and I just love for multiple different reasons, but it's also great with dealing with any of these diaphragmatic issues. So what you're going to do is you lie on your back and have your knees bent, your feet flat. Put your dominant hand on your abdomen and your non-dominant hand onto your chest. The first thing you're going to do is take a big deep breath into your belly, only your belly moving. And you want to notice the amplitude or the amount that your hand moves up. Now what you're going to do is you can breathe out all the way and you're going to breathe in a third of that distance. Stop, breathe in the next third, stop, and breathe in the final third. Stop, and then exhale all the way. So you're breathing in by thirds, never exhaling till you've reached the top of that inhalation. So you do that 3 times. And then you're going to exhale by thirds. So you breathe in that whole distance and then exhale a third out, stop, exhale the next third out, stop, exhale the final third out, and stop. Do that 3 times and then combine them together where you're going to be inhaling by thirds and then exhaling by thirds. This is an amazing way to just kind of really retrain that diaphragm, how to work and function. And you're getting great pressure gradient changes between your abdominal region and your thoracic region. When people are starting to improve and are having less symptoms, then I want them doing more intense yoga moves and spinal twists. But it's not until some of these earlier symptoms start to decrease, because doing too much twisting or limiting of your motion could actually cause that vagus nerve to get a little activated if there's restrictions there, and can lead to some more dizziness and headaches. So that's not something you should just jump into. I think it's important just to kind of get at the ground level first, make sure that the overall mobility of your thoracic spine, your rib cage, and those pericardial ligaments is starting to be restored, and then challenge it with more difficult exercises like yoga. Following this approach and really looking critically at how the body is moving and what's happening with this pericardial ligaments has led to a lot of success for my patients in feeling better and getting back to what they were before they had COVID. If there was one episode that I would want people to share and put out there in the world, it's this one. So if this episode at all spoke to you, if it made you think of someone that you love that's struggling with their bodies post-COVID, please send this to them. Please share it out there. And hopefully we will start to bring the pieces together of what is like after a post-COVID world. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.